Hello, good evening. How are you? How are you doing? Welcome to another session of Ask the Doctors. Yes, my name is Dr. Frederick Unugbohai. People call me Dr. Fred Dostar, and I always tell you good life, na sense. This program is called Ask the Doctors. No, I just speak Oyibo. Ma go back to Pidgin English. Sorry, no vex. Sorry. Okay. Now, this program, we call them Ask the Doctors. The program holds every Sunday by 8 p.m. Nigerian time. We've been privileged to have been having this program for the past 4 years now. Every Sunday, myself as the host and Dr. Robonose Osaze Israel as my co-host. Today on the program, we'll be talking about alcohol, the harmful effects of alcohol. A lot of people, especially guys, whenever I make a video and I tell them that alcohol is bad, number one, they begin to insult me. Most times when they insult me, I dodge the insults. You can never catch me. Number two, some of them get very angry. Say you are not a doctor, you are a quack. Whoa, you cannot collect my license. Some will even go to chat GBT and type nonsense and come and tell me that alcohol is good for the body. Now, today on the program, we're going to be talking about alcohol. Is alcohol good or bad? Let me start on this note. Alcohol is bad. Capital BAD. If you say I'm lying, oh yeah, today, na me and you. But before I start, how are you? Where are you watching me from? Oh yeah, drop in the comment section. If you know you can hear me loud and clear on Facebook and YouTube, I want you to tell me where you're watching me from. Oh yeah, let's go. Uh-huh. Let's see. We get somebody watching me right now. Fuso hands. Yes. Fuso hands. We're talking about alcohol. If you know that you take alcohol, come. No worry. Come. Let us reason together. If you know you have not started taking alcohol before, nice. Come. Let's reason together. People are watching me on TikTok. I had to leave my TikTok live stream on so that my people on TikTok will benefit. Though I'm not going to take their questions on TikTok unless they come to Facebook or YouTube. Is that okay? Very good. You're watching me from Port Harcourt. Okay. Blessing is watching me on Facebook. Nice. So we're talking about the harmful effects of alcohol, and I'm expecting Dr. Israel to join me this evening on the program. There is a match going on between Spain and England. Well, I can't watch the first half. After this live stream, I will be watching the second half. So let's go. What a way my village people don't attack me, but God pass them. Yes, I ain't taking your questions on TikTok, my guys. Huh? I'm sorry, but you can listen to me now. Alcohol, according to WHO, alcohol is a psychoactive substance. Oh God, help me miss that stuff. Alcohol is a psychoactive substance. As a matter of fact, alcohol has been classified as a carcinogen. They don't talk say alcohol na something wey fit cause cancer, class 1 carcinogen. Meaning say if you dey take alcohol, you dey take something wey fit make you collect cancer. Yeah, you dey whine? Continue. Now, people will tell you that alcohol is good for the body. They say if you drink alcohol, it will help your heart and this and that and that. Well, in the past, there were some studies that came out with this conclusion, came out with this result and findings. But like we all know in science, oh God, I speak Oyibo grammar. Make I speak Pidgin English. Like we know for science, every day science they do research. Recent research don't come show say alcohol has no benefits. As a matter of fact, in whatever amount you take the alcohol, e no get any benefits. Whether you say you take am small or you take am plenty, e get no benefits. And people will tell us that, but I have to take alcohol to keep body and soul together. I need take alcohol so that make I feel day high, make my mood, as a man. How man would they live life? Man no go dey take alcohol. Wetin me go come tell you be say how man go dey live life, man no go dey kill himself. You dey whine? My guy, alcohol go kpai you. So let's start talking about the harmful effects of alcohol. If you dey hear me, abeg, comment I dey hear you. Share this video, make people come learn. Share this video because I don't notice you know they like share this video, but you dey like ask me question. And if I no answer, you go dey curse me. So please share this live session. Oh yeah, share. Share. Okay, we are now. These people know they share. Share now. So what are the harmful effects of alcohol? Number one, if you take alcohol go enter your stomach when you drink am. When e enter your stomach, your body go break down the alcohol. E go enter like your liver area. Your liver go break am down. So the first part of your body where they collect problem, for alcohol matter, now your liver. Okay, Dr. Israel is in the house. Now your liver, Dr. Israel, if you are ready, just give me a thumbs up and I'll bring you up. Okay. Let's bring up Dr. Israel. Dr. Israel, good evening. How are you doing?
Good evening. Happy Sunday.
Yeah, happy Sunday to you. Welcome. So I don't talk about brief introduction about alcohol. I don't talk say alcohol no get any benefits and many other things. So I can't start to the talk say the first harmful effect of alcohol. Say now the liver they metabolize them, now the liver they break them down. So the liver they collect the first hits of alcohol, and the liver they hits. And when the liver don't they collect problem, if it cause what we they call initially hepatitis, if it start to dey damage your liver cells, when it damage your liver cells, we can't enter. Now remember, all these things no they happen immediately. So you feel they drink alcohol 1 year, 2 years, 3 years, 4 years, 5 years, you no go see any problem for your body. But the damage don't they go on small, they destroy the liver cells. Later, it go progress to what they call fatty liver disease. It go progress. It dey waka. You no go see am. By the time you go come see signs, say be like say person don't get problem, the liver damage don't dey massive. Go come cause liver cirrhosis, liver cancer. You dey understand that be? Okay, good. So make I hand over to Dr. Israel. Make Dr. Israel also took mouth, talk on top this thing where we talk about alcohol, and then we'll continue the discussion. Dr. Israel, over to you.
Okay. Thank you, Dr. Fred, and I welcome you today. As many person when they listen to us, I welcome you to today's session. Yeah, the harmful effect of alcohol. So we don't already know what alcohol be, and alcohol now waiting almost everybody, almost majority of the persons for this world don't take at one point or the other. At different points, people don't take alcohol. In fact, I know say we fit us say nobody will never take alcohol. Yeah, to some extent. So it's one of the most consumed substance in the world. Alcohol is one of the most consumed substance in the world because many persons they drink alcohol in different form. So there are two type of drinkers, and we have the social drinkers, those when they drink occasionally. And we have the problem drinkers. Inside that problem drinkers, we can't get those when they drink to cause harm to themselves, and those when they drink even when harm don't they still continue to they drink. Yeah, so they still continue to they drink. So those are now in terms of what we talk about, those when they drink now, social drinker and problem drinkers. So and when they talk about this harmful effect, they affect everybody, all of them, whether the social drinker or the problem drinkers. Just the problem is that those will be the problem drinkers. Now then they quick come down with problem pass. pass the social drinker. So if you go take 10 years for if you go take 5 years for some one problem to happen, for social drinkers, if he pass 10 years, they no go get am. While for problem drinkers, within that 5 years or so, they fit get that problem. So that's just the that's just the thing. That's just the thing for that one. So we can't all say there are so many parts of the body when alcohol they affect. In fact, alcohol they affect almost all the organs of this of our body. All the organs, all the system of the body, alcohol they affect that one. So apart from the problem when you go cause, um we still get the socio-economic problem wey alcohol go cause. We get the psychological problem wey alcohol go cause. So apart from medical condition, physical condition, we get the psychological condition, physical condition, and the socio-economic condition when
Mm.
alcohol go talk cause. So I go break all of them small small. I go try to talk one or two things for these three parts when I don't mention. But make I first leave Dr. Fred, make Dr. Fred talk one or two things join.
Yeah, thank you so much, Dr. Israel. Welcome, everybody. We dey talk about alcohol, the harmful effects of alcohol, and Dr. Israel don't let us know. Say alcohol now something where a lot of people all over the world they drink well, well. People they take them for so many reasons, social reasons. Some they take them because they need them to function. Many, many things. And Israel don't break the kind problem with alcohol because it affects almost every area of our life. Your medical life, it will affect you, your relationship, your work life, your mental state, and a lot of things. So me right now, I more talk about the medical parts because of time, because a lot of people, yes, I get people where they watch me from TikTok, they don't come Facebook. Eh? They won't hear me and you because when they did TikTok, they couldn't hear Dr. Israel. So they don't move from TikTok, come and YouTube and Facebook Live. So you all from TikTok, I see you. Cynthia, Edet, I see you. Welcome very much. So if you ask us any question that is not related to alcohol today, we know go answer your questions. No vex abeg, so that make we dey on the topic. Now, let's talk about the medical effects of alcohol on the body, like all the kind of thing wey alcohol fit do for you, the medical parts. Before we come talk about other areas of alcohol, I don't talk about the liver. Dr. Israel, over to you. Let's continue.
Okay, so Dr. Fred don't talk about the livers, everything when you go fit, some of the things when you go fit cause for the liver. So I'll start from the brain. So the alcohol go fit affect the brain, and if it affect the brain, it can cause change in mood. I go fit change our mood, fit change our balancing. In fact, that's the acute effect when it go give us. So our balancing, coordination, and all of that can be affected. Now you make go see people when they don't dey drunk, dem no go fit waka well, dem go dey stagger up and down. So that one na for the brain. And also when I say e go change their mood, the way of their thinking, dem no go dey think well, dem no go dey think right, they can do things irrationally, things wey dem no suppose, wey dem no go fit do when dem no drink. They can actually just do it because they don take alcohol. So e go fit still affect the heart. E go cause arrhythmia. Wetin we dey call arrhythmia? E mean say the heart, the way wey the heart take dey beat, e no go dey beat well like that. So that one na arrhythmia. E fit cause arrhythmia, e fit cause cardiomyopathy, that is, e go affect the muscles of the heart. And another one wey e fit cause hypertension. E fit cause hypertension for the individual. And this one dey happen because when you take a lot of alcohol, the alcohol go cause a lot of cholesterol, increase in cholesterol, and all these things fit happen. When for the brain too, e fit cause stroke because e fit damage the artery and the veins for the brain, and e fit cause stroke as well for the individual. Now more we move comot, we don talk the brain, we don talk the heart. For the lungs, e fit make person quick get infective diseases such as tuberculosis. How e take dey cause this one? Because e go, and even pneumonia, because as at this point, alcohol go weak the immune system of the person, and if you don weak the immune system of person, that person fit come down with all those all those disease. That person fit come down with all those disease, fit come down with shit. Dr. Fred, you dey hear me?
Yes, I did hear you loud and clear.
So if he come down with all those diseases, if he come down with tuberculosis, if he come down with pneumonia, so that for the lungs, because it don't affect the immune system. So that immune system is very important. So remember when we talk about this way they reduce the immune system, in our last discussion, one of the things na excessive use of alcohol. So now we still dey talk at that now. So it will reduce the immune system for that ground. Now for pancreas, if it affect the pancreas na one of the organ wey dey the body wey dey produce some chemicals wey dey help us dey digest our food and wey dey produce some hormones as well. So if it affect the pancreas, causes acute pancreatitis or chronic pancreatitis. When this one happen, e go lead to poor production of all these hormones and enzymes wey dey help us dey metabolize our food. And when that one happen, e come mean say most of our food wey we take, we no go fit metabolize them. And you know, when you no fit metabolize your food, you no fit do good things with your food. You know, say e go come make you dey reduce and make you dey lean. So that one come bring to us to let you know say e go fit affect your muscle, e go fit cause muscle wastage for individual. When we say muscle wastage, we say the muscle go dey tiny because of too much consumption of alcohol, because you don take too many alcohol. So another thing wey you go fit do and be say e go fit affect the person reproductive system. E go fit affect your reproductive system, meaning that for men, e fit affect erection. I know say this one now, some persons fit come me say, fit ask us question say, but people dey take alcohol, dey take all these something bitters and all these things, and they make them dey function very well. Yeah, it will make you function very well for the beginning, but as time goes on, it will actually cause problem to erection, it will cause problem to sperm production and all that. So it actually cause problem for all those aspects of the body. And another thing is that if it cause problem to the bones, if it cause weakness of bones. So also it's also good for us to know say alcohol dey related to some cancers. I don talk so many things. I don talk a lot of things. It's still good for us to know say alcohol dey related to some cancers. Cancers of the liver, even the intestinal cancer. It gets a lot of cancer when alcohol.
Dr. Israel, sorry, I don't know what happened. Your network been dey crack, dey break. I don't know whether na only me, but it be dey crack. Let me bring you up. I don't know what happened. Yeah, it dey break. Yes. Okay. You dey hear me now?
Yeah, you dey hear me now?
Yes, I dey hear you, but the
Can you hear
network
me?
like the network dey
Okay.
break somehow.
Okay. Okay, let me cut and call back and come back.
Oh yeah, now. Oh yeah, okay. Well, welcome. If you listen to us, we talk about the harmful effect of alcohol. Dr. Israel don't talk about a lot of the systems. They affect from the head, they affect your memory, they affect your balance, they affect your heart, they give people heart disease, they affect even your stomach area, your GIT, if you increase your risk of coming down with gastritis, if it affects your bones, if it make people bones weak, if it affect your reproductive system, if it make you know if you perform well, if it affect woman hormone, if it make woman develop hormonal issues like hormonal imbalance, you get. Now, people go talk say, but I dey see people where they drink alcohol and they affect them. Now remember, say everybody body they different, number one, and the way the body they break alcohol for one person, it they different from the way the other person they break alcohol. And number two, everybody where they drink alcohol, not everybody go tell you whether the alcohol they give them problem. Person way they drink alcohol no can't tell you say I they get this problem for my body. So you can't really know if this alcohol where this person they drink don't they damage in body. Now only you know. Now And that thing again, with Dr. Israel talk about now cancers, alcohol they related to so many cancers. Alcohol they related to breast cancer. Alcohol they among the things too, if it cause liver cancer, colorectal cancer. They are among what they cause esophageal cancer. So if you take alcohol, like I said before, let's see. Um, let's see. Okay, wait. We'll come and take your questions. But what I notice be say we know they share. We never share this live session. Everybody, please share this live session so that more people go come watch. Oh yeah, let's go. Share the live sessions. Hmm? Yes, yes. Let's see. Share. I beg, I beg, I beg, I beg. We are talking about the harmful effects of alcohol. If you just they come, we talk about alcohol. We spoke about alcohol no get any benefits. People come they ask me right now, is it true that your body needs certain amount of alcohol? How? Why? Where you do get that from? Where? I see people who go talk say you need alcohol so that your body and your system will be balanced together. But there is nothing like that because according to the WHO, no amount of alcohol is safe for your body. Now, mentally, alcohol fit dey among the things wey dey cause anxiety, fit dey among the things wey dey cause depression. People no know. People go tell you say, when I dey very stressed, when I dey go through anything for work or things dey happen to me, I drink alcohol. Now, remember, if you drink alcohol because you dey go through one stress or the other, anything wey alcohol go do for you na acute, na just in the immediate, e no go sustain am. So e go just cloud your body, cloud your brain. After a while, e go comot. And e dey among the things wey dey cause anxiety, dey among the things wey dey cause depression. Dr. Israel is back. Let me bring him up. Dr. Israel, how far? You dey hear me now?
Yeah, they hear you.
Okay. It
Okay,
seems they delay, but go ahead. Go ahead.
they are continuing now.
So I will talk about the effect of alcohol on the mental state. Yes, as alcohol.
Yeah,
Now we get one thing where we will talk. I don't know whether we don't talk about all the effect of alcohol on the body. On the endocrine system, I mentioned hormone. Some women, it also affect their period. Now, a woman will get belle, we can they drink alcohol. I don't see many women go tell you say I they drink alcohol. Now, alcohol can actually affect the woman picking for her belly. People don't know, women don't know. Say if you affect the pikin development, the pikin brain development, and other part, if you even give the pikin problem, wey be say when they go born the pikin go come get some kind abnormalities, birth defects when dem born the pikin. If it
yes,
happen, so some
yes.
people no know, go just dey drink am. If you make woman lose her belle or make the pikin small for belle, many things wey alcohol fit cause for the body. So I no know who tell you say alcohol dey safe. Dr. Israel, over to you.
Yeah, yes. Thank you, Dr. Fred. Those are very important things when women and even the men when they try to give their women alcohol to drink, make them know. Even the man himself, the testosterone, you see, they affect the testosterone, thereby reducing how the production of sperm go be. And so these are some of those things. I'd already talked about the immune system, say they affect the immune system, and I also say they related to many cancers, breast cancers,
Yes.
stomach cancers, pancreatic cancers, cancer of the mouth, cancer of the throat. Eh? Alcohol they related to all these cancers in one way
Mm,
or the other. In one way or
mm,
the other. Even studies don't even show say yes, many people don't die from cancer when they related to alcohol pass every other cancers, pass other cancers wey not dey related to alcohol. And studies also don show say even though you say na small alcohol you dey take or na many alcohol you dey take, at the end you fit still come down with with all this effect wey we dey talk. The only difference na just time,
mm,
so somebody wey dey take am all the day, all the time, can easily get this problem on time, while those person wey dey take am once a while, we fit still get this problem but in a long while. Another thing, alcohol go fit still affect the kidney. alcohol go fit still affect the kidney, and you fit cause problem to the kidney as well. So these are all the different things when I think I can remember where alcohol fit cause. I don't say many other things there. Remember I say I divided into three. We talk about the mental state, the physical condition, and the social economic condition. Now, Dr. Fred don talk about the mental state. When you talk about anxiety, depression, alcohol fit cause depression and mood change and all that. Alcohol fit cause depression, and depression fit make people dey drink a lot of alcohol so that make dem see if dem fit comot for that their depressive mood. And another thing wey e fit still cause, e fit cause alcohol intoxication, withdrawal symptom, and all those things. And those are very severe problem when they make people even they forget, they not they remember anything again, and so on and so forth. So when we talk about the social economic situation, is that alcohol go, if people wey they drink anyhow, they drink they drink well, alcohol fit affect their finances. If you see make people not they come close to them, I believe say you can imagine for that your street, you don't see somebody where they drink anyhow. Imagine the kind of person when they relate with them. Even you not they relate with them, because you I bet this one not go fit enough give me any information that is important. So the social life of that person is somehow secluded, is somehow separated from the community. They make that person not they too useful to the community, and everybody get their role when they play for the community. So if the person not going to play a role, is positive role for the community, now problem to the community. They even make the community they lose finances and otherwise, and it go still affect the finance of the family. It go fit affect the finance of the family, because money when you suppose bring for house, they do better thing, you use and take go buy drink, they drink, and when you don't over drink, it can't give you problem. That same money when you supposed to do better thing, now you consider you stay the treat yourself. So it can affect the finances of the family. It can lead to separation. It can lead to so many things in the in social economic the social economic life. So that's why we decide say today let's talk a little about this alcohol, because we know so many people they take them, and we know say many things still dey when all people they take apart from alcohol. But we just say we start with this alcohol, and it is very dangerous to take alcohol anyhow, because your liver first of all is in danger. Dr.
Yes,
Fred.
thank you, Dr. Israel. Like wetin Dr. Israel talk, your liver is in what? Is in danger. And a lot of people they take alcohol. Now, we don't talk about the mental part, the physical part, then the social part. Some people don't even lose their job. I believe you don't hear story about somebody wey be say then talk say the person go office, the person can't go drink alcohol, can't high for office, then sack am. Some people have lost their job because of alcohol, and we don't talk am before. Say alcohol has no benefit whatsoever. Now, if you get any question for us on alcohol, no fear, drop them in the comment section. We won't take all your questions where they related to alcohol now. Make we talk am. But let's start with this one. Somebody don't talk say I heard that alcohol is good for the heart. That if you take this one, it will help the heart. So many stuffs. If you listen to what we talked before, we said in the beginning that alcohol in whatever quantity has no benefit. And the more you take them, the more the damage. So alcohol, they help the heart. If you want to help your heart, true, what you go do? You go exercise. You go stop increase salt intake. You go eat healthy food. You go leave fatty and the other stuff. That's those ones now. Waiting go help the heart. Nor be the alcohol where you drink, and then go help the heart. Dr. Israel, you have anything to add to this question where somebody drop? Because I see him. He say, is it true that our body needs some alcohol, like small red wine, 1 cup a week?
Okay, the funny thing is that even the body can actually produce its own alcohol. you not really need to call the giver your own. The body can produce its own alcohol. Yeah, I know saying I red wine you want to talk when you talk about that. We know there are some studies where don't come out on that regard. But we not really know if it give us how many cup or how many shots you need to take to dey good for your heart. So it is better say, if you notice wetin I talk, I said that every time you take alcohol, you may be increasing one problem or the other. So even though the red wine, the red wine itself, in fact, there are two different type of red wine. There are red wine that are non-alcoholic, and they will still do that same work as the
Mm,
alcoholic red wine. And so
mm,
if you know say uh, 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 sorry, alcohol, if you think say yes, it go protect your heart, remember say not be only your heart dey your body, every other organ still dey your body. So you cannot be thinking of just one organ in the body and leave the rest organ uh, vulnerable to other things. Remember we said the
mm,
liver na be the first, na be one of the organ wey dey in danger when it comes to alcohol. So we need to protect the liver, and it's very important. The liver not get part two, not get second
mm-hmm,
brother. If
mm-hmm.
anything happen to them, it don't finish.
Don't
So
finish.
please, yeah, as I earlier said, the body can produce its own alcohol. Don't worry yourself about that.
You don't hear, oh, your body go produce the alcohol where you need. If indeed you need alcohol, your body go produce them. Not be the external one where you pour inside your mouth. Nine go help you. Now we have a question here from Abdul Kasim on YouTube. Those where they watch us on YouTube, I salute you. He said, please, can alcohol help to reduce body weight? Oh yeah, maybe address.
Okay,
Him.
I forgot to talk one thing about alcohol. Alcohol can cause diabetes. It can cause obesity, mostly
Mm,
truncal obesity. When we say it can cause obesity, you see all those men wey don overdrink, you come see their belle go come big like say they get belle.
mm,
Na alcohol join wey dey cause that. So if you see those ones, at least e go answer your question. E reduce their weight. No, so alcohol will not reduce your weight. If you want to reduce your weight, go for exercise, maintain your
mm-hmm,
diet, know the kind
mm,
of diet you take, and go for exercise, and then you go know say you don dey. And see a dietitian at the end, to cram it up, see a dietitian, then you go know say you are ready to lose weight. Not be go take alcohol. If you take alcohol, you are not dey lose weight. But remember, I say e go even increase cholesterol for your system, and that can even cause hypertension and many other things for your system. So it doesn't reduce weight.
so you don't hear wetin Dr. Israel talk, e no dey reduce your weight. If you get questions for us on alcohol, abeg drop am now, may we take your questions. And then no forget, share this live session, share this video, so that more people can come and watch and learn. If you want to sponsor this program, you want to place an advert, send a mail to drfredosta@gmail.com, wherever you watch us from, whether you're in Nigeria or outside Nigeria, you want to sponsor the program. You're welcome. Send an email. Let's see again. A lot of people are not asking us, okay, we have a question here. Please, is palm wine subject to all the dangers of alcohol? Hmm.
Okay. I don't know how I will answer this question. Now you know say palm wine, e dey ferment. When e ferment, you will not start having those alcohol features. But before e ferment, and yeah, before e ferment, is a natural drink. Yeah, it's a natural drink. And remember, there's nothing that's 100% free. And
Mm-hmm.
so even the palm wine, when you take it in a moderate form, you get the benefit, and the every other things, the side effect you may not get it. And also when you take palm wine and you see say it's not good for your body, it is better you leave it. It is better you leave it. So there's no cause for alarm. So when it
Yeah,
don't
thank
ferment, it don't turn ogogoro, kind shepe, then you fit come dey think of all these many things wey we talk about.
Yep, yep, yep. Now, for those people who believe in natural stuff, I they take natural drink. Palm wine a natural drink. When you take them as then bring them out in moderate quantity because too much of everything is bad. It's beneficial for you. Some studies have shown that palm wine gets high concentration of vitamin B inside. But when you can't leave the palm wine, make it can't ferment, you are no longer getting any benefit. You don't allow chemical reaction to go on inside that palm wine. It's no longer fresh, and then it has left that phase of being natural. You hear me? So good. Collins Igbinedion, what about red wine? What about red wine? We don't answer them before. I think you just come. There are two types of red
Yeah,
wine.
we talk about red wine already.
Mm,
There are different
we-
type of red wine. There's a red wine that is free from alcohol, and then there's a red wine that has alcohol. So I think you can choose the one that is free from alcohol. If you choose the one that is free from alcohol, you should be safe. Eh? However, now even when we dey talk say harmful use of alcohol doesn't mean that people does not still dey drink alcohol and and remain healthy or live their life. It doesn't mean that. But we just want you to know so that when you dey take the alcohol, you should get it in the back of your mind say I
mhm.
don't need to take it too much. I need to take a little quantity so that even though I say even those when they drink those that are social drinkers,
Social drinkers,
these
yeah.
problems are still there,
Mm.
but doesn't mean that it will come on time. And so what it means is that they can be with it, they can be alive and live their full life without even having it. Yeah. So that's that one. I'm just waiting. I'll talk for that on that case
Yeah, thank
because
you,
I know
Dr.
say na
Israel.
red wine. People no
Mm-hmm.
talk about spirits. And you wey dey talk about red wine, most of the time you no dey drink red wine, na spirit dem dey consume.
That one will
Na
be like
spirit dem dey
acid.
consume.
Yeah. Okay. Thank you, Dr. Israel. If you still get question, I beg for on alcohol, ask us now. I beg. Share this video. Then we notice something. When we tell people to stop alcohol, it is difficult, really. Some people cannot stop. So wetin we dey try beg say if you dey take alcohol, then now reduce the quantity. That does not mean that we dey permit you say, oh yeah, everybody be taking small quantity o. Because some people find it almost impossible to stop. Dem no fit stop. No matter what you tell them, they say they cannot stop. So those kind people, na them we go tell you say, okay, we can take a little, your social drinkers and the rest, if you really, really want to take it. But if you can stop, you feel you can stop, then um we encourage you to do so. Yes. Any more question for us on this alcohol matter? After we finish now, at that time we'll come to see different questions. I want to ask this. Ask now, I beg you. We are talking about the harmful effects of alcohol, and we don't tell you what alcohol fit do for your body. Alcohol can affect your brain, can affect your heart, can affect your stomach, can affect your lungs, can affect your immune system, can affect your liver, can affect your reproductive system, can affect your hormones, many things in the body. Can affect your work life, your relationship, your finances, your mental state, many things. And to cap it all, everything we dey talk, we have backings, we have medical reference. Don't be say we dey talk them because we want talk them. We dey talk them because there are medical references to back up whatever we are telling you. Alcohol they cause cancer as well. You understand? But no be say as you just take them today, you'll get the problem. This thing, if you take them for a long time, you not go see any problem. And then maybe one day, if you just wake up and you discover that this problem did the body. Huh? Okay. Any more questions for us? We no get question on alcohol today. Why una they keep quiet? Ma call your name. Ma call your name. Adiola, Adeshola,
Because
John.
na alcohol now.
Here now, because now
And now
alcohol.
some people yeah, some people are really dependent on alcohol. It means say they not fit do without, they not take alcohol every minute they want to take alcohol. So those kind of persons, we dey classify them as alcohol dependent. Yeah.
Mm,
So sometimes we not dey even first quick know say this person is actually depending on alcohol until e leave alcohol for some time. And maybe
mm,
leave am for one day, you will now start seeing the effects of that person leaving alcohol. It become irrational, start becoming irritating. Eh? Um, some will come dey violent, one even dey attack person. Later you come see say the person dey forget some things and all that. So when you don dey see all those kind case, you know say, oh, this person was once dependent on alcohol, and it's not a good thing. It's not a good thing. Now the problem with all this substance use, both alcohol, they are all substance, they join the substance use. The problem with this substance use is that it's like a cycle. It's like a cycle. There's no there's no really a full remission. Let me say a full remission, because some people go go into a program to get remission, that is to stop taking alcohol, and they will stop it. After a while, they will go back again, and
mm,
they will constantly go back to that program again. So it becomes a cycle, just like a visual cycle, that they do the thing over and over again, and that thing they consume your finances as well. They consume finances as well. So it is better not to get to that stage than to come reach that kind stage and come dey get a lot of problem. So let's just be mindful of wetin we take. So this one na still to tell us say everything wey we take, we should take it in a moderate form, so that we no go
mm.
get too many problem for our life and for our body.
Yes, we have few questions before we run out of time. We get few questions. Blessing Osagie, he say alcohol like cream. Alcohol like cream liquor. Is it good like best? Okay, all those cream where we know them drink, we get alcohol inside. Are they okay? Hmm. Okay,
Okay,
make I answer.
no, don't worry. Okay, when we say alcohol, we say alcohol. When we dey talk about alcohol, we not specify which alcohol. So as far the alcohol, the drink gets alcohol at all, that's what we are
Hmm.
talking about. And whether na best or whether na four cousin or whether na kind, whether na beer, we are not really we are not specifying, or whether na red wine, when the alcoholic red wine, we not dey specify anyone. All what you are saying is just the alcohol in it. So if you dey take best and you over drink am, alcohol dey and you go still get all those effects. Some people dey drink best and they'll start to dey do like true or false. So if they fit drink best and the acute effect can take place, why can't the long term effect not take place? So you think am.
Hmm.
So there's nothing like this one good, this one bad. No, they are all the same.
Okay, make we answer this question. I hope you understand what Dr. Israel said. We know they talk, we know they mention branded products. As long as alcohol they inside, people go talk say, but now this one, as long as there's alcohol inside, now we dey talk about general. So the discussion today now on alcohol. So if wetin you dey drink, alcohol dey inside, know that you are not gaining based on research. Whether you drink small or you drink plenty, the more you dey drink the alcohol small, the more you are putting yourself at risk of whatever problem wey alcohol fit give. Shey we get am abi? Ehen. Okay, now we are having questions and let's try to be fast. Is it true that some medicine contain alcohol? Let me try to answer this before Dr. Israel. Listen, abeg. When they produce medicine they go through many chemical processes. In the process, no be the alcohol wey you dey pour inside your mouth drink. Na im dey take mix am, because when you do chemistry, you get wetin we dey call chemical structure, OH, hydrogen, and the rest and the rest. So in the creation of the medication, some of them fit get this incorporated in them. No be say dem dey give you alcohol swallow. Mm-mm. Do you understand? They're not giving you alcohol to drink because of the medicine. Because I know waiting people won't talk now. If our medicine get alcohol, so why are they not giving it to us? When you are creating a chemical process, some of the reaction, alcohol will be inside that reaction. That does not mean that they are giving you, because this is now deeper than this program. Dr. Israel, I beg, help me break up.
Okay. One thing you should know is that once when I forget to talk is alcohol is one of the substance that is also dependent. When people they dependent in, so you go notice say all those drugs when they act like alcohol, those are substances that they use to
Okay, what happened? Dr. Israel, your network don't hook. Okay, let's see. When he comes back, we'll continue from where he stopped. Two bottles of beer in a week, is it bad? I can't give you a yes or a no answer. But Mr. Collins, based on the thing we don't talk about, you should have your answer. Now your body, now you know. I can never tell you that two bottles of beer in a week is good. No. But you have to listen to yourself. We have told you before. The quantity you take, whether not small or I've been plenty, you, it can put you at risk. But that does not mean because you drink and today will give you problems. Sometimes it can take a long while before it comes up. Uh-huh. Please now share this video. My people, you know they share. Oh, okay. Anthony came late. Please, I need clarification from alcohol and palm wine. Is palm wine also harmful? Anthony, you just entered. This is the problem. People know they come on time. Palm wine in the natural form is safe. In the natural form, when they come out from the tree, it's safe. But we encourage you to take it in moderation. When you leave palm wine down, keep them after a while, it go undergo fermentation. You can they convert to ogogoro kai kai. If it can make you high. That one na the alcohol, they don't leave them down because they won't make it pass one process, go another process. When you come on your palm wine, it is natural. It gets some medical benefits. It get a high concentration of vitamin B. That one I know. uh But if you can't even take them past a certain level, if it can make you also high, that is why we dey encourage people say take your stuff in moderation for this regard. But for alcohol, alcohol in any amount is not safe. I am quoting the World Health Organization. I'm not quoting ChatGPT or one Iyabi Taishe study. No, I'm quoting from the World Health Organization. Alcohol in any form is not safe. Yes, yes, yes. Let's see, let's see. Let's see. Um, I have questions. Some people saying the body need alcohol is really true or not? Because other side, alcohol is damage our body. Now, will we completely stop to drink it or what? And alcohol in the body is coming from where? So number one, Mr. John, your question no really did clear. It did cancelled. It did mumbled up, but I think I have an idea of what you're talking about. Your body, whatever alcohol wey your body need, Mr. John, your body go produce am. Any alcohol wey your body need, your own body na im go produce that particular alcohol for you. No be you go say my body, dey say my body need alcohol, make I drink alcohol give my body. All those sen ten ce na for people wey wan defend their alcohol drinking habit. So if your body needs any amount of OH, the body during the process of metabolism and the rest, na the body go produce am by itself. No be you go find one bottle of one bitters drink say make I give my body. Do you understand? Okay, Israel, okay. Welcome back. You were saying something before.
Sorry for the network issue. So what I was trying to say is that yes, when alcohol is one of the substance when be dependent. Alcohol is one of the thing when people they dependent in. So if you see notice, you get some substance, some drug when people they dependent in, and they act like alcohol, but they no be alcohol. They
Mm,
act. That's why we say that they act like alcohol. Because they get that euphoria. They say they give that euphoria of feeling high. And most of these drug are drug when they use for surgery. That makes sometimes when you people go for surgery, if they give them the drug, e no work, they go ask you dey take alcohol, you dey drink, because this drug dey act like alcohol. Why? Just to make sure say as at that period in time you are able to control the pain when you wan pass through as at that time, make dem for fit control the pain. So no be say drug and no, not really, it's just that they have some alcohol like substances wey dey, and all those one are chemical activities, chemical production and all that.
Chemical processes. Yes, thank
And
you so
Mona
much.
still know say all drugs, sorry, Mona still know say all medication na poison. Na only when they give am for
Mm,
the right dose na it be medication. So if you go
mm,
pack that na im make many people now when they take some substance, some medication when they dey abuse these days, they take am too much, they go get problem.
mm.
So you not go fit say make you just take anything because you wan take am. No, you just have to be careful. That's why we say moderation is the key.
Okay, thank you so much, Dr. Israel. Okay, because of time, we will do a brief recap. We'll just talk about all the things we don't talk about alcohol from the beginning. Dr. Israel, over to you.
Okay, alcohol na one of the substance wey people dey independent to. So and many people for the world dey consume alcohol. Many people dey consume alcohol. Yeah, alcohol get some harmful effects. So and there are different type of drinkers. We get the social drinkers, those wey no dey drink all the time, and we have the problem drinkers, those wey dey drink almost every day. Even inside that problem drinker, we get that bench drinker, those wey fit take, for men we say 6 bottles in a stand, while for a woman we say 4 to 5 bottles in a stand for women, while for men 6 bottles in a stand. So that for that. So we got talking about some of the harmful effects. We can't let you know say alcohol dey affect every part of the system for the body, and one of the
Mm,
system wey really dey affect, when they really dey cause get the issue, na the liver, and it fit cause liver problem, from hepatitis to cirrhosis and fatty liver disease and so on and liver cancer as well. So because talk say e go fit affect the brain, e fit cause stroke, e fit affect the heart, e fit cause arrhythmia, e fit cause cardiomyopathy, e fit cause weaken the immune system. So when e weaken the immune system, e fit lead to people to get TB or even pneumonia, and e fit even cause people to get HIV and AIDS, infective diseases, every kind of infective diseases. Because when people don dey drunk, they go fit dey do anything when they go dey do anything when they like, even to the extent say they no go protect themselves when they wan do wetin they suppose protect themselves when they do those things. So e fit cause infective diseases as well, e fit weaken the bones, e fit dry your muscles, causes myopathy, next muscle atrophy, e fit affect the pancreas, e fit cause cancers, different type of cancers. And so we mention all this because it also say e fit finish your money, your finances, e fit cause problem for your house, e fit make people run comot for where you dey. Because it was say if it cause a psychological problem, even anxiety, if it cause dependence, if it cause depression and all that, and some of all this one fit even increase the use of all this substance as well. If even cause psychosis, when person go come dey you understand, if even lead to that. So so these are the problems when we mention, and we consider say, yeah, even though we don't mention all these problems, we consider say even though we mention all these problems, it don't mean say alcohol you're bad. No, it don't mean like that. Yeah, there may still be one or two good things when we feel use alcohol do, but when you dey even use them for those things now in a little quantity, and you know say those things not be what you they do almost all the time. Yeah. So that na by the wayside. And we consider say if it affect the hormone system of the body for women, even for men, if it reduce if it cause erectile dysfunction as well. If it cause erectile dysfunction as well. So this one many of the problems. Then we were able to answer some questions. I know say we may not answer everybody question. So for those people who will not answer your question, two things involved. Either your question not follow our line of not follow the topic, or two, you ask question when we know the answer. And question like which drug I want to use, I will fit it talk to you, all those kind of things, and we know the answer those questions. So I think that's all. I think that's all from me.
Thank you so much, Dr. Israel. If you just come, sorry you came late. We've been talk about the harmful effects of alcohol because a lot of people don't disturb us about this topic. Now make we talk about them. So if you just come, no vex, try watch from the beginning when we end this live session so that you go know one or two things where we talk about and we clarified a whole lot of stuff. But I beg you, especially for those where they look for excuse to take alcohol. We don't come here to condemn anybody, but we just come here to give you medical facts. If you know, say you know fit stop totally in a small, you understand. We can't tell you to stop. You gonna need help if you really want to stop and you can't. Then we will encourage you to go and seek help, rehabilitation. But even at that, it can be still hard because sometimes it can be a circle. You go stop. If care is not taken again, you go again, you go come back. So you might need people to support you, to help you. But be rest assured, we talk am again for the program. Many things with alcohol fit cause for the body. It clear, abi no clear. Dr. Israel, your final words. Okay, you say waiting good for the body
Okay.
to take. Only water and palm wine that is good for your health. That one is a different discussion. I beg. Dr. Israel, final words.
Okay. I don't talk like that. Okay. My final my final word is, yeah. Make we thank you. Let me just say thank you. Everybody when they follow us, when they watch our video, when they follow this live section, thank you. You have done well, and we hope to always remain here to give you guys uh, the best, the correct, sorry, not the best, the correct information,
Mm.
the correct information as at the point in time when the video is being made. And why I talk that is because by tomorrow, studies will come out again when we change some few things. But as at the point of time when this video is being made, we did try to make sure say every information we give to you are correct. So thank you for listening to us, and we hope say you go follow waiting we talk so that all of us go live in good health for this world when we did, and for this world when we did. Thank you so much.
Thank you very much, Dr. Israel. Thank you. And to you where they watch us, we want to say thank you. If you don't know about this program, now every Sunday by 8 p.m. Nigerian time, we day here by the grace of God. We day here. So we encourage you to also help us invite your friends, share this video to them, may they come learn. And if you want to sponsor this program, now we qualify to get sponsors, and I think we can. So if you want to sponsor or you know any sponsors or want to put an advert on the program, yeah, send an email. We don't get to that level, and I think we did confident now to talk about them. So send us an email, and we'll take it further. Thank you once again. Can always tell you, good life now waiting. Good life, sense. Take care and have a wonderful evening. Bye bye.